Greetings, everyone. Welcome to another session by Nurture Oncology. So we started with basics of cancer in part one, and part two was briefed by Advait. Here in part one, Advait covered what is cancer, hallmarks of cancer, factors affecting carcinogenesis, and in part two, he went ahead in details of carcinogenesis and drug resistance, and he mentioned some trials at the ending. I would like you all to go back to those videos and see that information in order to proceed with this video further ahead for better understanding. So coming to the part three is focused on cell invasion. Metastasis would be covered in the next part because we tried a new approach this time, as in we are introducing you with a lot of areas of research going on in each step of cell invasion. Um, Briefly, we'll first of all see the steps of cell invasion and intravation, and then at every step, I'll give you with several topics, or you'll have several um, things to ponder upon and to start upon with your own projects. So, as you all know, after a certain signaling uh, and dysfunction in the cells and the dysfunction, the polarity of the cell, there is loosening of the intercell junctions, particularly cadherins. Cadherins are calcium dependent glycoproteins that anchor cells together by interacting with certain cytoskeleton elements and proteins. So, these keep cells in a line. And one family which we're going to extensively study in pathology is E cadherins. It's a major cadherin epithelial cell. Also acts as a tumor suppressor by maintaining cell adhesion and preventing metastasis. So blocking E cadherin function increases cell invasiveness, while reintroducing E cadherin can reduce invasiveness. So this is the first step in cell invasion. The second step is degradation of the extracellular matrix by MMPs or matrix metalloproteases. And there is a wide family of matrix metalloproteases. These basically makes a pathway for the cell to move into the extracellular matrix and then go into the lymphatics. So the part is done by matrix metalloproteases, and we have certain tissue inhibitors of matrix metalloproteinases, which normal regulate this response, and an imbalance between MMPs and TIMPs, which is tissue inhibitors of metalloproteinases, causes invasion. And the last step is migration invasion. So, because of all these responses, there is altered expression of integrins, which are essential molecules, um, and these molecules integrin leads to interaction between the cell and the extracellular matrix. So basically, integrin guides the cell into the extracellular matrix and further its migration into lymphatic channels and blood vessels. So now coming on to the areas of recent research. First of all, we're going to discuss a bit of N-cadherins. There are certain N-cadherin antagonists and N-cadherin agonists. The most utilized N-cadherin antagonist is synthetic cyclic peptide CHAVC. It's also known as ADH1. And you might all be thinking that why antagonists are used for anti-tumor response. When I said that cadherins cause or suppresses the tumorigenesis. So what happens is in a normal cell, when cadherins lose their function, there is apoptosis and suppression of various pathways. So that is the functioning of a normal cell. Um, so that's why certain antagonists have been utilized to promote apoptosis of tumor cells. Another effect is these uh, these pathways essentially increase tumor vascular permeability, makes cells more leaky, and facilitates the drug delivery. So it has been utilized as a combination therapy for multiple myeloma specifically. So drug delivery of bortezomib is being studied for multiple myeloma, and along with the N-cadherin antagonist. Then it has been used in solid tumors as pancreatic ductal adenocarcinoma. And the topic which I've highlighted in yellow are the areas where you can go upon and search in Google Scholar. You'll get a lot of articles. You can start with a review, you can start with an editorial, or you can start a new project and see where you can go with it. Then the N-cadherin antagonists are also seen to decrease the PDL1 expression. So PDL1 expression, basically it causes um, PDL1 causes the evasion of T cell recognition. So decreasing PDL expression will cause increased recognition by lymphocytes, obviously, and that facilitates cancer-mediated killing. And further, N-cadherin antagonists are studied in meningioma, neuroblastoma, and GBM. So there are very novel therapies in neurological tumors, and it's a very nice area to move forward with. You can also go upon and search some oncolytic viral therapies. Then gynecological tumors of phase 1 clinical trials are going on with ovarian carcinomas and fallopian tube carcinoma to study the response of N-cadherin antagonists. Then N-cadherin agonists have been studied for regeneration of neuronal fibers and regeneration of cartilage and osteochondral defects or pathologies. Here's a table giving certain names of N-cadherin antagonists and agonists and their stage of development and their therapeutic potential. So you can go upon these or search in a bit more detail. Then next we have matrix metalloproteinases. It has a variety of functions in different areas of body. It is involved in inflammation, it is involved in fibrotic diseases, angiogenesis, neurological pathologies, and cancer. So here's another table with the different types of cancers and types of MPs which are overexpressed in the references. What basically happens is chemokines send certain signals which activates MMPs, and that causes migration and invasion of the cells. These MMPs have been studied as biomarkers in breast cancer, gastric cancer, and squamous cell carcinoma. And in other therapeutic potential, MMP inhibitors were studied previously, and two synthetic inhibitors, that is bartismat and marsmat, were um, tested, but these were not very effective because of their toxic effects and side effects. And therefore, right now, selective MMP inhibitors are in preclinical and phase 1 trials, and these are both natural and synthetic. Certain marine derived compounds are also being studied along with it. Then we have an interesting area in MMP inhibitors, which is of my interest, that is use of nanotechnology to deliver MMP inhibitors. So the problem with the synthetic MMP inhibitors, which I mentioned earlier, was that MMPs are at several places. So there were a lot of side effects. And to remove or to decrease those side effects, nanotechnology using thermosensitive liposomes and metallophenols is being developed, and just specific to tumor areas that reduces the toxicity. This is very interesting thing, and I encourage you all to go and search more upon this. Then Atlas monoclonal antibodies are also being developed for MMPs. Yeah. Next and last part is integrins. Integrins, again, it has both tumorigenesis effect and suppressive effect. There are variety of integrins, and we can't cover it in one video. It would be a lecture itself upon it. I'm gonna just talk about the burning points uh, right now, and we're gonna start with immunotherapy. So integrin immunotherapy has shown increased effectiveness of PD-1 and PD-L1 inhibitors. So it has shown increased anti-tumor response, and therefore it is evaluated for combination therapy along with these inhibitors. There's an interesting interaction of TGF beta and integrins. Integrins stimulate TGF beta, and TGF beta causes increased immunosuppression. So blocking integrins would in turn decrease TGF beta signaling and decrease immune suppression in tumor microenvironment. So one of the integrin inhibitor which has been studied in preclinical stages is indomethacin, and after this we can CAR T cell therapy, which is chimeric antigen and receptor T cell therapy, which you might know for which is used for in leukemia and lymphoma. But the current area which is under development is for solid tumors, and specifically CAR T cells targeting integrins as a potent anti-tumor response. And preclinical stages include GBM and melanoma, and phase 1 trials are in breast, ovarian, pancreatic tumors. Other therapies include leukocyte-specific response, where integrin immunotherapy leads to increased T cell infiltration, colorectal carcinoma, and melanoma, and direct inhibition of integrins. So, um, thank you everyone for watching this and sticking to the end. I hope you like this. Please tell us uh, and review our videos, and mail us if in case of any doubts or references or any problem you face. We'd like to help you with the undergraduates, especially with any research topic or anything as such. Thank you so much. Stay tuned to Nature Oncology.